Welcome back, everyone. Today we're doing a deep dive into something pretty interesting. We're going to be looking at substance abuse and sleep disorders.
Yeah.
And, on the surface, they might seem totally separate,
Right.
but trust me, there's some surprising connections there. By the end of this deep dive, you'll have a solid understanding of, the clinical side of how different substances can actually mess with your brain.
Oh, yeah.
Why it's so important to recognize those warning signs early on, and how absolutely crucial
Oh, yeah, for sure.
a good night's sleep is for your mental health.
Big time.
And to really get into this, we're going to be using two main sources. We've got the DSM-5, of course,
Of course.
and a Clinical Psychopharmacology handbook.
Love it.
So yeah, get ready. It's going to be fascinating.
It is fascinating. What I think is so interesting here is that, substance abuse and sleep disorders so often, they kind of go hand in hand, right?
Yeah.
They can really feed off of each other
Totally.
and create that vicious cycle.
Oh, I can definitely see that connection.
Yeah.
So let's start with substance abuse. It's something we hear all the time.
Right.
How does the DSM-5 actually define it? I mean, clinically speaking.
Well, I know what's interesting is the DSM-5 actually breaks it down into two main categories.
Okay.
Substance use disorders, right?
Okay.
And then substance-induced disorders.
Gotcha.
And that distinction there, it's actually clinically super important because it impacts, how we approach both diagnosis and treatment.
Okay, so break that down for me. What's the difference between a substance use and a substance-induced disorder?
Okay, so substance use disorders, these are really all about patterns of behavior, right?
Okay.
So this is when using that substance, whatever it is, becomes a real problem in your life.
Yeah.
And it really starts to have this negative impact. Think of it as you're losing control,
Oh, okay, so it's not just about using it. It's about how that use starts to affect your life, your ability to actually function.
Exactly. Yeah, and the DSM-5 and outlines these very specific criteria, for example, needing more and more of the substance to get that same effect.
Right, which is tolerance.
Which is tolerance, exactly. Yeah. Or even struggling to cut back, even when you know it's causing problems at work, in relationships, all that stuff.
Yeah, those are definite red flags.
Yeah.
For sure. And what about substance-induced disorders? You mentioned that as the second one.
Yeah, so substance-induced disorders, these are more about the immediate effects, right?
Okay.
Of actually using a substance. So this would include things like intoxication, right? That altered state that's caused by the substance, or even withdrawal. And withdrawal is essentially those often very unpleasant symptoms that happen when you either stop or even just reduce your use.
Okay.
And, both intoxication and withdrawal, these can be incredibly dangerous.
Right.
Even life-threatening in some cases.
For sure, yeah.
So, substance use disorders are those long-term patterns.
Yeah.
And substance-induced disorders, those are those more immediate consequences.
Got it. Okay. So that's a really good breakdown of the two categories. So let's talk about a specific substance. Let's talk about alcohol. I read somewhere that it's the most commonly abused substance out there.
It is, yeah.
Is that accurate?
Unfortunately, yeah, it is true. Alcohol is the most abused substance. And, sadly, it affects a staggering 5 to 10% of adults.
Wow.
Which is huge when you think about it.
That's a ton of people.
It is a lot of people.
Yeah, and I think what makes alcohol so tricky is it's so readily available.
Oh, yeah.
It's often seen as totally socially acceptable.
Oh, for sure.
To use,
Absolutely. And, and to complicate things even further, alcohol can actually mimic the symptoms of other mental health conditions.
Oh, it's
mood and anxiety disorders, for example.
So someone struggling with alcohol, they could look like they have depression or anxiety.
It could, yeah.
Even if they don't.
Exactly. That's why, getting a thorough assessment from a qualified professional is so important.
For sure, yeah.
It's not always clear-cut.
Right.
What's causing what,
And our source material actually mentions this genetic component to alcoholism.
Yeah.
It was talking about something called the TOC1A1 restriction fragment length polymorphism.
Yeah, that's a mouthful.
I know, it sounds complicated, but essentially...
Essentially, it's a specific gene variation.
Okay.
And they've linked it to a higher risk
Gotcha.
of actually developing alcohol dependence.
Wow, that's fascinating. It really shows you that addiction is not just a simple thing, right?
It's not simple, no.
It's not about just willpower or making bad choices.
Right.
There could be these underlying biological factors.
Oh, absolutely. It's this complex interplay of your genetics, your environment, and your individual experiences, all those things together.
That makes a lot of sense.
Yeah.
And so speaking of treatment, I know there are medications out there that can help people manage alcohol dependence.
Yeah.
So how do those work? What are they doing?
So there are a few different approaches,
Okay.
One medication, it's called antabuse, and it essentially acts as a deterrent.
Okay.
It makes you super sick if you drink alcohol while taking
Oh,
it.
really?
Oh, yeah. Think like nausea, vomiting, headache, basically a guaranteed bad time.
Wow, okay. That's a pretty strong incentive to stay sober then.
It is.
Are there other medications that work differently?
Yeah, so another commonly used medication is called naltrexone.
Okay.
And this one works by blocking the pleasurable effects of alcohol.
Oh, interesting.
So, making it less rewarding, basically.
Okay.
And that can help reduce those cravings.
So antabuse makes you feel terrible if you drink.
Mm-hmm.
And naltrexone takes away the enjoyable feeling.
Right, exactly.
Interesting contrast.
It is, yeah. And, there are some newer medications out there as well, like acamprosate.
Mm-hmm.
And that one, they think it helps by influencing how the brain actually processes certain neurotransmitters.
Oh, wow.
So it's really all about finding the right approach for each individual.
Right, it's not one size fits all.
No, not at all.
And it's amazing how we're learning more and more about how these medications can actually target those specific brain systems that are involved in addiction.
It is fascinating stuff.
Okay, so let's switch gears a little bit. Let's talk about stimulants.
Okay.
I think everybody knows that stimulants give you energy, right?
Mm-hmm.
They're uppers. But how do they actually work? Like, what's going on in the brain?
So stimulants, they work by essentially flooding your brain with dopamine.
Okay.
Which is a neurotransmitter that we associate with pleasure and motivation.
Right.
So think of it like hijacking your brain's reward system,
So like really turning up the volume on those feel-good signals.
Exactly. Exactly. But of course, there's a downside to this, right?
I imagine so, yeah.
Over time, your brain gets used to this flood of dopamine,
Right.
So then it starts to need more and more of
Right.
that stimulant to achieve that same effect.
That's tolerance.
That's tolerance, exactly. And then when you try to stop using stimulants, suddenly there's this huge drop in dopamine, right?
Right.
And that leads to all sorts of withdrawal symptoms, things like fatigue, depression, and those intense cravings.
So it's just this vicious cycle.
It is a vicious cycle.
Our source material actually has this diagram in here labeled stimulant use on the neuronal level.
Okay.
Can you kind of walk us through what that's showing us?
Yeah, so this diagram is a really great visual representation of what's actually happening, right?
Okay.
So first you see this initial surge of dopamine, and then it's followed by reduced reuptake.
Okay.
Which means that dopamine, it's just hanging out in the synapse longer.
Okay.
So it's intensifying the effects, right?
Wow.
But then as tolerance develops, those receptors, they become less sensitive.
Okay.
Which means you need even more
Right.
of the substance
To get that same
exactly feeling. Exactly. So it's this cascade of events, right?
Yeah.
And ultimately, it leads to that really overwhelming feeling of craving.
So how do you even begin to treat stimulant addiction then, when the brain's in this like constant state of need?
Well, it's a really multifaceted approach, you
Okay.
know? During intoxication, we can use medications
Okay.
to manage those really immediate effects, things like beta blockers or even antipsychotics in some cases. Then during withdrawal, we have medications like bupropion,
Okay.
which can help ease that transition and reduce those really intense cravings.
So you're managing both the short-term effects and the long-term recovery.
Exactly, exactly. And for long-term management, we have medications like antabuse, which we talked about earlier,
Right.
as well as things like acamprosate, topiramate, and even modafinil. And these medications, they target different aspects of addiction,
Right.
whether it's reducing cravings, blocking those rewarding effects, or even addressing, any co-occurring conditions that the person might have.
Wow. So there's a whole arsenal of medications out there.
There are, yeah.
It's kind of fascinating and a little scary to see how these substances can really hijack that reward system.
It is. But, the more we understand about how these substances are actually affecting the brain,
Right.
the better equipped we are to help people who are struggling, right?
Absolutely.
And sadly, our next topic, it really highlights just how critical this understanding is. We're going to delve into the world of opiates,
Okay.
which is a category of substances facing a growing crisis.
Yeah, the opiate epidemic is a major concern. And it's not just about illegal drugs like heroin, right?
Right.
It's even prescription painkillers.
Mm-hmm.
They can be a gateway to dependence and addiction.
They can, yeah.
It's scary how quickly it can happen.
It's really scary. It's a stark reminder that even medications that are, meant for good
Right.
can have these unintended consequences.
For sure.
So to understand why opiates are so addictive, we really need to look at how they're interacting with our brain's natural pain and pleasure systems.
Okay, let's break that down. How do opiates actually affect us on that biological level?
So our bodies, they naturally produce these opioid-like substances
Okay.
called enkephalins and endorphins, and these help regulate pain and pleasure.
Okay.
So opiate medications and drugs like heroin, they essentially mimic these natural substances.
Okay.
They attach to the same receptors in your brain.
So they're tapping into that natural wiring for pain relief and pleasure.
They are, yeah. And because they're so effective at binding to those receptors, they trigger this really powerful cascade of effects,
Okay.
including, feelings of euphoria and that pain relief.
Wow.
But unfortunately, that same potency, it's what makes them so addictive, right?
Right, so it's like a double-edged sword.
It is.
And the withdrawal symptoms from opiates, I've heard that they can be absolutely agonizing.
They can be, yeah.
What's going on in the brain during opioid withdrawal?
So essentially, when you stop taking opiates, your body is suddenly deprived of those external substances that were mimicking its own natural opioids.
Right.
So this sudden drop, it creates a real state of imbalance in the brain.
Okay.
And it leads to a whole range of really unpleasant symptoms. Things like anxiety, agitation, sweating, muscle aches, nausea, vomiting, and those intense cravings. It can be really rough.
That sounds absolutely awful. So are there medications that can help manage those intense withdrawal symptoms?
Yes, thankfully there are. There are medications that can help manage both opiate intoxication
Okay.
and withdrawal. So for example, in cases of acute opiate intoxication, we have medications like naloxone and naltrexone,
Okay.
and those can be used to actually block the effects of the opiates.
Oh, really?
Yeah, they act as antagonists, meaning they bind to those opiate receptors, and they prevent the opiate from having its effect.
So they're essentially like reversing it.
Exactly, yeah. Now, for opiate withdrawal, the approach is a little different.
Okay.
We often use medications like methadone, buprenorphine, clonidine, and benzodiazepines
Okay.
to really help manage those often debilitating withdrawal symptoms.
And I know there are two main treatment strategies, right, for opiate dependence.
Right.
You got methadone maintenance and opiate antagonists.
Yeah.
What's the difference between those two approaches?
So methadone, that's a long-acting synthetic opiate,
Okay.
and it's used in a very controlled setting
Okay.
to help people gradually reduce their dependence on those other opiates, like heroin.
Okay.
So basically, it's providing a stable dose of opioids to kind of prevent those withdrawal symptoms and cravings,
Right.
but without the highs and lows of the original drug.
So it's about providing like a safer and more stable path
Exactly.
to recovery?
Exactly. Opiate antagonists, on the other hand, they use medications like naloxone and naltrexone to block the effects of opiates, right?
Right.
So if somebody relapses while taking these medications, they won't experience those pleasurable effects.
Oh, okay.
So you're basically removing the reward.
Gotcha. You're taking away the incentive.
Exactly.
So is one approach better than the other?
Not necessarily. It really depends on the individual, and the severity of their addiction.
Okay.
There's also a newer medication, a buprenorphine.
Right. Yeah, I've heard of that.
It's shown a lot of promise in treating opiate dependence.
What makes buprenorphine different?
So it's considered a partial opioid agonist.
Okay.
So it still binds to those opiate receptors,
Okay.
but it produces a much weaker effects from full agonists,
Gotcha.
like heroin or methadone.
So it's kind of meeting people halfway?
It is, yeah. It can help reduce cravings and block those effects of other opiates, but with, a lower risk of abuse.
Right. Which is huge.
It is, and what's really great about it is it can be safely monitored on an outpatient basis.
Okay.
Which makes treatment much more accessible.
Yeah, that's a big deal.
That is a big deal.
So we've been talking about a lot of heavy stuff.
We have.
So let's shift gears a little bit.
Okay.
And let's lighten the mood and let's talk about hallucinogens.
Okay, yeah, the substances that often bring up, tales of altered perceptions
Right.
and mind-bending experiences.
Exactly. Everyone's heard those LSD stories. But how do they work, really, in the brain? And are they addictive in the same way as, like, alcohol or stimulants or opiates?
That's a great question. So hallucinogens, they're unique.
Okay.
In that they don't usually lead to that same kind of physical dependence and withdrawal symptoms as those other substances we talked about.
Interesting. So they're not as physically addictive.
Right.
But they can still be problematic, I imagine.
Oh, absolutely. Hallucinogens can actually trigger something called transient psychotic states.
Okay.
And these are temporary episodes of psychosis.
Okay.
And that's characterized by things like hallucinations, delusions, and disorganized thinking, which can be very distressing
Right.
and even dangerous.
So it's like a temporary break from reality.
In a way, yes.
Wow.
The effects, they can be unpredictable,
Right.
and they vary a lot depending on the individual,
Sure.
the substance and the dose, all those things.
And I've also heard about something called flashback phenomenon
Yeah.
associated with hallucinogens. What exactly is that?
So flashback phenomenon, that's the re-experiencing of those hallucinatory effects,
Okay.
but long after the drug is worn off.
Wow.
And it's not as common as people think.
Okay.
But it is a real phenomenon.
So how does that even happen?
We don't fully understand the exact mechanisms behind it,
Okay.
but they think that hallucinogens, they can create these lasting changes in brain chemistry and in the neural pathways.
Gotcha.
So it's like the brain has this imprint of the experience,
Yeah.
and then certain triggers, they can just reactivate those pathways.
So it's like a lingering echo of the trip.
Yeah, you could think of it that way, and that must be really unsettling, to experience.
I would imagine so.
Yeah. Luckily, in most cases, just supportive therapy is enough to help people understand and cope with those experiences.
Gotcha.
But sometimes medications, like benzodiazepines or antipsychotics, those are used to manage, like, the anxiety or any psychotic symptoms that might become severe.
It's fascinating how diverse the world of substances is,
It is, yeah.
Each one interacts with the brain in its own unique way.
It really speaks to just how complex the human brain is and how delicate that balance is of those neurochemicals that really orchestrate all of our thoughts, feelings, and behaviors.
That's a great way to put it. So speaking of balance, let's move to a topic that's closely tied to both substance abuse and mental health. Sleep.
Yes.
You mentioned earlier how substance abuse can disrupt sleep.
Right.
But let's talk about why restful sleep is so essential for just overall well-being.
Yeah, that's a really great point. And this is where the conversation gets really interesting, I think.
Okay.
We often think of sleep as just a time for our bodies to rest.
Yeah.
But it's actually a period of intense activity for our brains.
Oh, interesting.
So it's not just physical rest.
Gotcha.
It's like mental and emotional restoration as well.
So much is happening.
Yeah, our minds are processing information, consolidating memories.
Wow.
And regulating our emotions. And when we don't get enough sleep, consistently quality sleep, it can have this cascade of negative consequences.
That makes sense.
Our source material actually highlights some really alarming statistics. Did you know that over 50,000 highway accidents every single year are attributed to driver fatigue?
50,000?
50,000.
Wow, that's a huge number. That really puts it into perspective.
It does, yeah.
We've all had those days where we're just running on fumes.
Oh, yeah.
Right? You're feeling foggy, irritable. What's actually going on in the brain when we're sleep deprived?
Well, when you're sleep deprived, your brain, it's like a machine that's starting to malfunction.
Okay.
You experience fatigue, of course, but you also have trouble concentrating, remembering things, making decisions.
Yeah.
Your emotional control weakens, which can lead to, increased irritability, anxiety, and even depression.
So it's like this domino effect. One system starts to fail, and it just kicks to another and another.
Precisely. And this cascade of consequences, it can have a really profound impact on both our mental and physical health.
So it's not just about being tired.
No.
It's really a serious thing.
It is, yeah.
That's why addressing sleep disorders is so important.
Oh, yeah.
Especially in the context of substance abuse and mental health.
Exactly.
This is all so fascinating. I never realized how much was going on behind the scenes when we're sleeping.
Yeah.
It really makes you appreciate how interconnected everything is. Our physical health, our mental well-being, sleep habits, even our choices around substances. It's all part of this, delicate web.
It really is a delicate web, and, understanding these connections is key to making informed decisions about our health and well-being.
Well said. We've covered a lot of ground in this first part of our deep dive.
We have.
Into substance abuse and sleep disorders. We looked at how different substances impact the brain, the complexities of addiction and recovery, and the crucial role of sleep in maintaining a healthy mind. But we're not done yet. Stay tuned for part 2, where we'll continue our exploration of specific sleep disorders and their connection to mental health.
Looking forward to it. It's going to be good. It's amazing, right?
Yeah.
How much our everyday choices, from what we eat and drink to,
Totally.
how much we actually sleep.
Absolutely.
It can impact both our mental and our physical health.
It's like we've uncovered this hidden world of
Yeah,
connections.
it is.
And the more we learn, the more we realize, like,
Yeah.
we don't know.
Exactly. And as we go deeper into these sleep disorders,
Yeah.
you'll see just how multifaceted this world really is.
All right, so let's talk about a sleep disorder that I think a lot of people listening can probably relate to.
Okay.
Insomnia. What is insomnia?
Yeah.
And how common is it?
So insomnia is incredibly common.
Okay.
In fact, research suggests that almost everyone experiences insomnia at some point in their lives.
Wow.
Whether it's just, a few nights here and there of tossing and turning because you're stressed out,
Right.
or a more persistent issue.
So it's not just like I had trouble sleeping last night.
Exactly.
That's not insomnia.
No, clinically, insomnia is actually diagnosed when you have consistent difficulty either falling asleep, staying asleep, or you're waking up way too early.
Mm-hmm.
And you just can't fall back asleep.
Okay.
And, this can lead to a whole bunch of daytime problems.
Right, because you're exhausted.
Exactly. Things like fatigue, irritability, difficulty concentrating, all of that.
That sounds miserable. What causes insomnia? Is it always linked to like stress or maybe even some mental health conditions?
Well, stress and mental health conditions, things like anxiety and depression,
Yeah.
those are definitely common culprits.
Okay.
But insomnia can also be caused by medical conditions.
Oh, okay.
Medications,
Interesting.
poor sleep habits,
Okay.
and even just environmental factors like noise or temperature.
So it's like a puzzle.
It is a puzzle.
Trying to figure out what's triggering it for each person.
Exactly. A thorough assessment is crucial
Yeah.
to figure out what that root cause is.
Okay, so how do you treat insomnia? I imagine a lot of people reach for those over-the-counter sleep aids.
They do.
Right.
Yeah, and while those are certainly readily available, they're often not a good long-term solution.
Okay.
The gold standard treatment for insomnia is something called cognitive behavioral therapy for insomnia.
Oh, wow, that's a mouthful.
It is a mouthful. It's called CBTI for short.
CBTI. Okay, what is that?
So CBTI focuses on actually identifying and changing those thoughts, feelings, and behaviors
Okay.
that are contributing to the insomnia.
Okay.
It involves techniques like sleep restriction,
Okay.
where you actually limit your time in bed to improve sleep efficiency.
Interesting.
Stimulus control, which means, you create a consistent sleep routine and a good sleep environment.
Okay.
And even relaxation training
Gotcha.
to help reduce that anxiety that people have around sleep.
So it's not about masking the symptoms.
Right.
It's about really addressing the root of the problem.
Exactly. You're basically retraining your brain to associate the bed with sleep
Mm-hmm.
and creating those healthy sleep habits.
And that sounds way more effective than just taking a pill,
Yeah, and research has actually shown that CBTI is highly effective,
Okay.
both in the short term and the long term for relieving insomnia.
That's great to hear.
Yeah.
Okay, let's move on to a sleep disorder that sounds a little more
Okay.
intense nightmare disorder.
Yeah.
Now, I know everyone has nightmares sometimes.
Yeah,
Right.
of course.
But when does it become a disorder?
So nightmare disorder is diagnosed when someone has these frequent, vivid, and disturbing nightmares
Okay.
that cause significant distress,
Mm-hmm.
and they interfere with sleep.
Okay.
It's not just about, the content of the nightmares,
Right. Because some people, they could have like
Yeah.
a really disturbing nightmare, but it's like a one-off.
Exactly. Yeah, it's about how often they're happening
Okay.
and how much they're actually impacting the person's life.
So it's the frequency.
Right, exactly.
And the interact.
Exactly.
And I imagine these nightmares, like they wake the person up, right?
Yeah, they often wake the person up.
Okay.
And they can leave them feeling scared, anxious, even depressed. And it can be super disruptive
Yeah.
to both their sleep and just their overall well-being.
I can imagine, yeah. What causes nightmare disorder? Is it always linked to like trauma or PTSD?
So trauma can definitely be a contributing factor, but it's not the only cause.
Okay.
Stress, anxiety, certain medications, sleep deprivation,
Okay.
and even some medical conditions can play a role.
So it's another one of those multifactorial situations
It is, yeah.
where it can be hard to pinpoint the exact cause.
Exactly. And that's why treatment often involves a combination of approaches,
Okay.
including things like psychotherapy to
Mhm.
address any underlying emotional issues, stress reduction techniques, and sometimes medication.
All right, let's talk about a sleep disorder that I know can have some serious health consequences.
Okay.
Obstructive sleep apnea.
Yeah.
So what's actually happening in the body when someone had sleep apnea?
Yeah.
And why is it so concerning?
The obstructive sleep apnea, this is where the airway repeatedly becomes blocked during sleep,
Oh, wow.
which causes pauses in breathing.
Okay.
And these pauses, they're called apneas. They can last for several seconds or even minutes.
Wow, that's a long time.
It is a long time, and that leads to these drops in blood oxygen levels.
And I imagine someone with sleep apnea, even if they sleep like a full night,
Yeah.
they're exhausted the next day.
They are, yeah, because their sleep is being constantly interrupted. They
Yeah.
never really reach those deep restorative stages of sleep.
Right, that makes sense.
And those repeated drops in blood oxygen, those can be dangerous for your cardiovascular health,
Okay.
increasing the risk of things like high blood pressure, heart disease, even stroke.
So it's not just a sleep problem.
Right.
It can be a very serious health problem.
It is, yeah. Obstructive sleep apnea is not something to ignore.
What are some of the signs that someone might have sleep apnea?
So some things to look out for are things like loud snoring,
Okay.
gasping for air during sleep,
Mm-hmm.
and excessive daytime sleepiness.
Okay.
Morning headaches and difficulty concentrating can also be some red flags.
Gotcha.
If you notice any of those, it's definitely important to talk to your healthcare professional.
Absolutely. Let's talk about some treatment options. What can be done for someone with sleep apnea?
So the most common treatment is something called continuous positive airway pressure, or
Okay.
CPAP.
I've heard of CPAP machines.
Yeah.
I have to admit, they look a little intimidating.
They do take some getting used to.
Yeah.
But for a lot of people with sleep apnea, they're a real game changer.
Okay.
So the CPAP machine delivers this pressurized air through a mask that you wear while you're sleeping. Okay. And this helps keep that airway open and prevents those apneas from happening.
Gotcha.
There are also some lifestyle changes that can help.
Okay.
Things like weight loss, avoiding alcohol before bed, and sleeping on your side. Sometimes surgery is needed to address any, structural issues in the airway.
So a lot of different options depending on, I guess, the severity of it.
Exactly.
Okay, last sleep disorder I want to cover in this section is wasteless leg syndrome.
Okay.
Now, I don't really know what that is,
Yeah.
but the name makes me think of, someone who just can't stop fidgeting.
That's a pretty good description.
Okay.
So restless leg syndrome, or RLS, it's this neurological disorder where
Okay.
you have this overwhelming urge to move your legs. And it's often accompanied by these really unpleasant sensations like tingling, creeping, or pulling.
Wow.
And these sensations, they tend to get worse at night,
Oh, no.
which makes it really hard to fall asleep and stay asleep.
Yeah, that sounds awful.
It is, Imagine trying to relax
Yeah.
and fall asleep when your legs feel like they need to constantly be moving.
Oh, that sounds so frustrating.
It is incredibly frustrating, and it can lead to significant sleep dysfunction, daytime fatigue, and even mood problems.
Yeah, because you're not sleeping.
Yeah.
What causes restless leg syndrome? Is there anything specific that triggers it?
So we don't fully understand the exact cause.
Okay.
But we think that it involves problems with the brain's dopamine system.
Okay.
Iron deficiency can also be a factor,
Okay.
as well as pregnancy, certain medications, and medical conditions like kidney disease and diabetes.
So again, it's another one of those multifactorial situations.
It is.
Where there could be a lot of different things.
Exactly. And that means treatment often involves addressing any of those underlying medical conditions,
Okay.
iron supplementation if needed,
Mhm.
medications that target that dopamine system.
Okay.
And then even just simple lifestyle changes like regular exercise, avoiding caffeine and alcohol, and keeping a consistent sleep schedule can also make a difference.
It's incredible how many different sleep disorders are out there
I know.
and how they can affect our lives in such big ways.
It is amazing.
It really makes you realize how important a good night's sleep is.
It really does, yeah. And, it's also important to remember that these sleep disorders, they don't usually exist in isolation.
Right.
They often occur alongside other mental health conditions,
Okay.
creating this really complex web of challenges.
That makes sense because we talked earlier about how substance abuse can disrupt sleep,
Right.
but it seems like it goes both ways.
It does, yeah.
Mental health conditions can interfere with sleep,
Mm-hmm.
and then sleep problems
Yeah.
can make those mental health challenges even worse.
Exactly. It's a bi-directional relationship, for example. Anxiety can make it hard to fall asleep.
Totally.
But then a lack of sleep can actually make your anxiety worse.
Oh, wow.
Depression can lead to insomnia
Mhm.
or even hypersomnia, which
Yeah.
is like excessive sleepiness
Okay.
So, and those sleep disturbances can further fuel those depressive episodes. It's a real vicious cycle.
So you can't really address one without considering the other.
You can't, no. It's like trying to untangle a knot.
Totally, yeah.
That's why treating sleep disorders is often like a key part of effective mental health treatment.
Okay.
And vice versa.
That makes sense.
This is where collaboration between healthcare professionals is so important.
Yeah.
You know, we all need to work together to make sure that people are getting that comprehensive care that really addresses both their sleep and their mental health needs.
So important.
It is.
This has been a truly eye-opening deep dive into the world of sleep.
It has, yeah.
We've explored all these different complex sleep disorders, gained a deeper understanding of how closely sleep and mental health are connected.
Yeah, they really are.
Stay tuned for part 3, where we'll bring it all together and explore what all this knowledge means for our own well-being. Wow, we have really journeyed through some fascinating territory.
We have.
In this deep dive, from substance abuse to these often overlooked sleep disorders, it's been quite a ride.
It really has.
So as we kind of wrap up this whole deep dive,
Yeah.
what are the key takeaways? What can our listeners really take to heart from all of this?
I think one of the biggest takeaways for me is, just the complexity of the human brain. It's this delicate ecosystem,
Yeah.
And when we disrupt that balance, whether it's through, substance use or sleep deprivation, it can really have a ripple effect across our entire well-being.
It's not just one thing. It's like
It's not.
our physical health, mental well-being, our sleep habits, even our points around substances.
Absolutely.
It's all connected.
It really is. And that interconnectedness, it's crucial for
Rough.
making good decisions about our health. We can't just focus on one thing without thinking about the others.
Like a web, right?
Yeah.
You pull on one strand, the whole thing's affected.
Exactly.
And speaking of interconnectedness, another key takeaway for me is that early intervention is so important.
Oh, absolutely.
Whether it's recognizing like subtle changes in behavior that might signal substance abuse or like those early signs of a sleep disorder.
Yeah.
Taking action early can make a world of difference.
It can. And the good news is that there are so many different treatment options and resources out there to help people who are struggling with these things. We talked about medications that can target specific neurotransmitter systems, therapies that address those underlying emotional issues, and just strategies to promote healthy sleep habits.
Right.
There's hope for recovery and well-being.
It's empowering to know that we're not alone in this and that there are people who understand these issues.
Absolutely. And, knowledge is power.
Yeah.
The more we understand about substance abuse, about sleep disorders, and their connection to mental health, the better equipped we are to take care of ourselves and our loved ones.
I love that.
Yeah.
Knowledge is power.
Yeah.
Well said. So as we wrap up,
Okay.
is there a final thought-provoking question that we can leave our listener with?
How about this? Now that you have a deeper understanding of substance abuse, sleep disorders, and how they're connected to mental health, how can you use this knowledge to make better decisions, more informed decisions about your own well-being and the well-being of those around you?
That's a great question. It challenges us to actually apply this information to our lives.
Yeah.
And, we can all be advocates for our own health and the health of our loved ones.
Absolutely.
Well, thank you so much for guiding us through this fascinating deep dive.
It's been my pleasure.
And to our listeners, thank you for joining us. We hope you learned something new and feel empowered to prioritize your well-being. Until next time, keep exploring, keep learning, and keep diving deep.